Na safari hii katika Mfahamu Kiongozi tutakuletea viongozi aina mbalimbali.
My name is Sami Kamanu, a qualified occupational health and safety trainer at Kenya Red Cross Training Institute. What we do a couple of courses ranging from short medical courses, occupational health and safety courses, and academic courses. These academic courses, this is a long-term program that teaches or trains an individual to become an EMT or a full paramedic who is able to work in an ambulance. So in terms of the short medical courses, we do courses such as basic life support, advanced cardiac life support, pre-hospital trauma life support, and advanced care for trauma for nurses. Among those, now occupational health and safety programs deals with the first aid, fire, and occupational health and safety trainings.
Right.
So I'm here on behalf of Kenya Red Cross Training Institute to talk about first aid training.
Right.
Thank you. So today I'm here with my colleague. We work together, but then he will simulate a casualty or a patient who has a heart attack, seizure, and the last part, nose bleeding.
Nose bleeding. Fantastic. And the fact that we're using him as a model of an adult for this case.
An adult.
And you'll also be telling us, I mean, he's a man, but then there are also variances when it's a man as well as it's a woman. And wherever you're watching us from, you can always interact with us, throw in all those questions, and Kaman will be answering them for you. In case you have any questions, and just to maybe have factual information on all this. You've probably had theories happen pale, but then Commander will be telling you how things are, and we'll definitely be doing more of a 70% a practical kind of a session, and also kuguzia 30% theory hapa. So yeah, so first off we begin with the heart attacks.
Sure.
Kuna kuga na ile heart attack jana, nilikuwa na watch game ya Man U.
Yes.
Nikapata na heart attack kadogo tu. Ile but then tell us also, are there scales of heart attacks? What do we need to know when it comes to heart attacks?
Okay.
And mostly even for adults? Are there heart attacks sometimes you're probably having it, but you also don't know?
Yes.
Yes.
Thank you very much, Stanley. I think it is very important to inform the viewers that when you're talking of a heart attack, we are talking about a real medical emergency. And a real medical emergency here will translate to death. And that is why we need to be very keen in terms of understanding what a heart attack is.
Okay.
So basically, a heart attack is a medical condition where we have the blood vessels that are supplying the heart with oxygenated blood is blocked completely. That means there is no blood that is going to the heart to give oxygen and nutrients. And you see, a heart, as any other organ, requires oxygenated blood and nutrients to function properly.
So if I remember my biology, is that the pulmonary?
So this is the coronary arteries.
Oh, coronary, yeah.
Yes. Now the coronary arteries will narrow down and eventually block.
Okay.
And this blockage will cause blood obstruction to part of the heart muscle. So the heart muscle, part of the heart muscle will die. And when it dies, that is where trouble begins. And that is what we call heart attack.
What causes this though?
Many factors. Many factors. We can talk of a sedentary lifestyle. For example, someone who is not exercising. We're also talking of other underlying medical conditions such as hypertension.
Right.
We're also talking of diabetes type 2 and uncontrolled or elevated cholesterol in the blood. And this elevated cholesterol in the blood, it is what will now go into the coronary arteries and attach itself on the coronary artery. And when it attaches itself on the coronary arteries, it becomes smaller. Eventually, it can obstruct the coronary artery, whereby now blood will not be able to pass through.
There's something our parents love to say, unataka kunipatia heart attack.
Yes.
And this really mostly does with the psychological stuff.
Yes.
And mostly stress.
Yes.
When the body is pumped up with stress,
yes,
due to any kind of factor,
yes,
can that also be a reason?
Precisely. Actually, one of the major causes of heart attack is stress, because stress will lead to other underlying conditions. Like, for example, a poor diet, someone who will have uncontrolled activities or inactivity. And for example, I have not also mentioned when I talked of sedentary lifestyle, you'll start drinking a lot of alcohol and then cigarette smoking. Actually, cigarette smoking is one of the causes that can lead or can predispose a person to heart attack.
Right.
So it is very important for us, first of all, to understand what heart attack is, what can cause heart attack, and then we'll also take you through how to manage this casualty. And then probably we can also talk of what can we do to prevent or minimize a heart attack?
Most definitely. His name?
Yes, his name is Lawi.
Lawi.
Yes.
So, for example, Lawi is having a heart attack right now.
Yes.
We're with him, having a conversation about Manchester United and Man City, and suddenly he starts having a heart attack. How do I know Lawi is having a heart attack?
Okay. Who can get heart attack?
Yes.
Of course, the risk factors, we're also looking at age. There are certain age that has a high risk factor, for example, from the age of 40 and above. Mr. Lawi here works in a reputable firm, and he's just walking and going to his usual business. And then before we know it, he starts complaining of chest pain. Now, pause, Mr. Lawi. They are normally a precursor to heart attack. Now, what are these? These are the early signs of heart attack. I know you have talked about someone who's saying, I watched Manchester United and I got a heart attack.
Yes.
Okay, basically this is just a phenomenon where we're just relating to how someone feels emotionally.
Yeah.
But now here we are dealing with the organ itself that pumps blood. Now it is important to understand what really happens. Sometimes a person can be climbing a stairs. Then you're climbing a stairs, then you feel a lot of chest pain. And then when you get a seat, you sit down, you relax, the pain disappears. When it disappears, then it means that could be the beginning of a heart attack.
And you're saying for someone, we're largely susceptible to someone above 40 years old.
Yes.
But there are, even younger than that, who also get, what could be, is it all those factors that you've been telling us?
Of course, yes. But nowadays, if you look at the statistics, younger people are also predisposed to the dangers of heart attack. And again, as I said earlier on, it is our lifestyle. What do we eat? For example, we are eating foods that are rich in cholesterol. And this is what can predispose someone to heart attack.
Right.
So the precursors to heart attack, that is a medical condition called angina. Now, what happens is the blood vessels narrow, but it doesn't block completely.
Okay.
So we have that the blood can still pass, but it is inadequate to perfuse the heart so that the heart can get adequate oxygenated blood. Right. That is why when you're doing vigorous activity, you realize that you can get that pain temporarily, but when you sit down or when you become not anxious, the pain disappears. But now when it blocks completely, that is when someone gets heart attack. So Mr. Lawi, he works in a reputable firm, and suddenly he starts complaining of massive chest pain. So what is going to happen? He will actually change, and then he will clutch the chest, and then Mr. Lawi, are you okay? Are you okay?
No.
Are you okay? Wait, what seems to be the problem?
I am feeling a lot of pain in my chest.
Where exactly?
Here.
Here, okay.
Yes.
So the chest is paining. So it means Mr. Lawi has massive pain. Where does it radiate to?
The left.
Okay. Now that's a clear indicator that he could be suffering from heart attack, because the pain is crushing the chest, and it is radiating either to the jaw or to the left side of the shoulder. Now, if that happens, then the next thing that is going to happen is he will feel palpitations. So you'll actually feel the heart pumping, and that is very dangerous, yes. So what you need to do is to recognize that this is a true medical emergency. And please take note, if someone presents with this classic sign, it is the time to call an ambulance immediately. So I will make sure that Mr. Lawi sits down in a comfortable position. So please sit down, sit down, sit down. Okay. So you reduce inactivity so that the heart is not excited to continue to pump faster. So Mr. Lawi will be seated in a comfortable position. I will also take some cushions and then slightly elevate his legs, at least upwards, like that. Okay, so Mr. Lawi, my name is Sami, and I'm here to help you. So please relax.
Yes.
I have called an ambulance.
Okay.
So as I watch Mr. Lawi through this process, I will immediately call an ambulance and inform the ambulance service that I have a casualty or a patient whom I suspect to have heart attack. But then I'll need to describe the current presentations of the patient. So what's going to happen is, besides the massive chest pain he's having, he will have difficulty in breathing. Because the heart pumps blood, the heart takes the oxygen and then redistributes throughout the body. But now he's also not able to breathe well. The skin will change color, it's becoming pale. So this clearly indicates that he's actually getting worse. So at this point, Mr. Lawi,
yes.
Okay, so I don't want you to move. So the ambulance is on its way coming, okay? Have you had these medical conditions before?
Yes.
Are you on any medication?
Yes.
Now, if he or she has a medical condition that has been diagnosed before, then they could be having their own medication.
All right.
So some of the medications that they could have include a nitroglycerin, which is administered through a spray, or if not, they may have been prescribed aspirin, which I will give at this point. Now, aspirin is a blood thinner. So what aspirin does, when I give to him, he will need to chew, not to swallow with water. Chewing essentially means that part of the mucus, the oral membrane will be able to absorb, and it will go directly to the bloodstream, which now will help to thin the blood, because that is the problem.
Though, when you say you administer for him aspirin,
yes.
So we're in a situation where even someone watching us, they're probably a relative or someone, a friend, and they had a heart attack.
Yes.
Are they also allowed to administer this? And also because often we're told when matters first aid,
yes,
the doctor is the one who's going to be administering any kind of drug. Right. So you just do the first aid, yes, ensure this patient is live, they're breathing, and then the doctor will administer. So where do you draw the line between all that here?
Good, thank you very much. Let me say this, a first aider should not administer any medication. However, a first aider can assist a patient with their own medications that have been prescribed. I hope that is clear.
So Lawi should have this
medication
with him. And not you removing it from the bag and giving him?
Yes, it's not me to remove from the bag. But we are saying aspirin, because it has been proven to help a person who is in cardiac arrest, can still be administered. It's only aspirin, no any other medication. Why are we saying this? It's because, one, as a first aider, you must be trained to administer it, and there are conditions. Let me talk about the conditions. Number one, the casualty should not be allergic to aspirin. Number two, the casualty should not have any other medical conditions, such as ulcerations of the gastrointestinal tract. And then number three, should not have had a recent surgery. So as a first aider, because you are trained, you are aware that there are certain questions you must ask this casualty. And in asking this casualty, there are certain parameters that you must do. For example, are you allergic to anything, either oral or environmental or medications? You must ask.
What if they don't know they're allergic to, let's say even if it's aspirin?
Yes. So if you're not sure whether they are allergic or not, so at this point, again, take cautions, because as we said earlier on, you may not give. Why you may not give? It's because you may not know how it's going to react with the casualty. But what you are saying here is, if you know, or if you are aware that the casualty has this medication and they have used before, then it means they may not be allergic to it. So it is important to continuously investigate what is currently happening to this casualty. Yes.
Right.
Yes.
Okay.
So Mr. Lawi, since now I'm aware that Mr. Lawi is not allergic to this medication and had prescribed this medication, so I'll give aspirin to chew. And he will chew slowly, and then at this point, I will look for a way of taking Mr. Lawi to the hospital. Now, why are we talking about this as a true emergency? It's because within no time, remember we said the signs and symptoms, massive chest pain, difficulty in breathing, then the next thing is the casualty will become unconscious.
So does the aspirin reduce all this, the chest pains and all
Precisely.
that? Okay.
Because it's a blood thinner. And remember here, we're also looking at blocked blood vessels. So we are looking at making the blood try to go to the heart, actually to perfuse the area that has been injured.
Okay.
Yes, but remember, this is temporarily. He needs to be at the hospital so that a thorough investigation is done, and then it is identified what kind of heart attack he has, so that now further medical care can continue. Yes.
So Lawi at this point is Lawi is good to go to the hospital.
Yes, now it's good to go to the hospital, but now, as we said earlier on, it is always important to minimize activities. So we don't want to excite the heart. So at this point, if it is possible, okay, if the distance to the vehicle is a bit far, we may need to carry him. Carrying him also prevents the activity of the heart. Yes. It is important. That is why the paramedics need to come with their stretcher. They need to carry him and then take to the hospital. Yes. Now, the worst case scenario, the person will go into cardiac arrest.
Right.
And in cardiac arrest, another intervention, that is cardiopulmonary resuscitation.
Right.
Yes.
Any additional tips on the heart attack now? Because for this is Lawi as a man.
Yes.
Does it also vary depending on gender and all that?
Okay. Heart attack attacks all age groups, all gender. It doesn't choose. And here, what we are saying here is it is very important to understand the reason why the heart attack has happened. One of the key things that is also important to note is as much as we are talking of the lifestyle that we live in, even obesity is a risk factor. So I think what we now need to discuss here is what is it that we need to do to prevent this occurrence or prevention of heart attack. Number one, have regular exercise. It is important. Number two, let us also look at the diet that we take. The foods that we take, it's very keen. Let's just avoid foods rich in high cholesterol, which again can predispose a casualty into this. And then let us go for medical checkup. Uncontrolled hypertension is actually a leading cause of heart attack. Let's watch on that. And then diabetes. Diabetes type 2, actually, which is acquired diabetes, it must be controlled because it is one of the leading causes of heart attack.
Right.
And of course, let's control our drinking habits and our smoking habits. Yes.
Fantastic. Last time we were with you, or matters even the whole breathing, and you're telling me lazima kume tai. Does it also apply for this?
Very true. Why do we just loosen? Because loosening basically essentially allows the body to be free. And when you talk of loosening is basically freeing the person, but you may not completely remove because the person, you see, when you have constricting clothing, it's actually obstructing the blood vessel. So loosening basically enables free flow of blood to the body system.
Right.
Yes.
Right.
Yes.
So now we can cross over to the seizures.
Okay, Mr. Lawi, thank you very much. Okay.
Oh, because I was so higher.
Okay.
Now for the seizures, what do we need to know about seizures?
Good. So seizures, seizures again is a medical condition where we are talking of abnormal electrical activity of the brain. So you realize that the brain has its own electrical impulses that helps in body communication. So when there is abnormal firing of these electrical impulses, then it will come with effects such as abnormal body movement. This is what we call seizure. And an example of a seizure is epilepsy. But again, what causes seizure? What causes seizure is, as I said, epilepsy. There are other factors such as fever or high fever. Someone who has been injured, for example, head injury.
Okay.
Yes. Someone who has had poisoning, or someone who has had a drug overdose, or someone who probably, like for example, they were enjoying their one or two things, alcohol can also lead to seizure. So here we are talking of this abnormal firing of the electrical impulses. But now when it comes to epilepsy, it's a combination of many forms of seizure. Now which can lead to jerking, okay, or abnormal body movement in which the body is not able to control its own activity. And at that point, the person will fall down. So basically, when a person falls down, okay, then it means you need to take precautions, or you need to take care of this casualty to take them through the activity. I must say that there are many forms of seizure,
Does the mind tell you? Oh,
Thank you very much. So that's another form of seizure.
Okay, so the
absence seizure.
Oh, okay.
So I'm talking to you, but
you're right. For how long?
It's for a few seconds.
Wow.
So you might think that I'm ignoring you,
yeah.
but
from a moment I also thought.
Yes. So basically, we are looking at many forms of seizure. So there's
okay.
There are some body parts that can twitch.
Yeah.
Okay, they can move, or sometimes you can just stare.
And you're completely.
Completely, you can't even remember what is happening to you at that point.
Does the mind prepare you for this?
No. Remember, as I said earlier on,
yeah.
Abnormal firing of the electrical impulses. You see, when I say electrical impulses, let me make it easy for you to understand.
Okay.
When I move my hand, how did my hand move? It is the signal from the brain to the muscles and the bone so that I'm able to raise my hand. That is how the body works. But then when my hand just moves uncontrollably, then it means the signals have broken. So that means there are too much signals that are firing and which are making my body not able to respond appropriately. So when it comes to staring, then it means you are not in control. And that is the function of the brain. Yes.
And mostly we do witness the people around us having the control kind of movements.
Yes.
For the limbs as well as the hands and all that. And you'd find unaambia mshikilia mtu vizuri asijiume. Are we doing the right thing?
Okay.
Tell us.
So Mr. Lawi, please. Okay. So the next thing, a person will have seizure. Okay. They will fall down. Okay. Now, of importance is to recognize that someone has epilepsy or seizing.
Okay.
So this phase is also critical because the body is uncontrollable.
Okay.
Now, the first thing that you must do is always to protect the head and the airway.
Okay.
So at this point, I would want to come close to the casualty. Okay. So ensure that the casualty was not eating.
So you need both pillows for that?
Yes, I'll need both pillows. So one, I'll put it on this side.
Okay.
And then this other one, I will place it on the other side. You can use anything. It could be a sweater, it could be a blanket, a sheet. Just place something beneath the head.
So something soft also?
Something soft.
Okay.
Or your own sweater.
All right.
Now, point to note is when they are jacking, fitting, you are not supposed to restrain them.
Okay.
Yes? Don't restrain them. Why? Because if you restrain them, what is going to happen is you are going to accelerate the jacking and fitting. Right. So actually it will not stop.
So let them be.
It will continue. Let them be. Please take note. Watch if they were eating. If they were eating, at this point is very dangerous because they could choke. So if they were eating at this point, you would want to quickly turn them onto the side, okay? Turn them onto the side and ensure that the object is able to come out.
Okay.
Very, very important. So it is important to allow them to continue jacking, fitting until it stops. Do not put anything on the casualty's mouth. We are fond of putting a spoon or a stick.
Ndio asijiume ulimi.
Asijiume ulimi.
Is there any problem akijiuma ulimi?
Tujiulize, what is the problem ukimwekea kijiko ama kijiti?
Ataiuma.
Ukimwekea atayuma. Ama another danger, hiyo object inaweza ingia ndani. Sindio? So that is what we are trying to prevent. It is more dangerous to put something inside the mouth. Akijiuma ulimi ni sawa. It will take its healing process.
Okay.
And see what we are concerned here is because the body is stiffening, okay, anaweza jiuma which is still okay, but our concern here is hata kijiuma hiyo damu isikue mingi ambayo inaweza rudi ndani. So at this point, let us try as much as possible to keep monitoring the airway at this point, but do not put anything on the casualty's mouth. Do not put anything on their hands so that they grab tuachane na hiyo. Again, it is unnecessary because they can injure themselves.
Right.
And remember, during fitting, when they fell down, they could have injured their head. Again, these are the things that we need to be observant. Now, what is important to note is how long is the fitting or jacking? It's supposed to take at least 2 minutes. If it takes more than 5 minutes, it is time to call an ambulance immediately because it is more serious. If for one reason or another, the casualty was a pregnant mother, it is important to call an ambulance immediately.
Immediately it happens?
Immediately it happens, call an ambulance.
Right.
Because at this point, we are not so sure what could have happened and which could also interfere with the fetus. Again, let us also look at if probably it ends and then it reoccurs again. This is a person whom should go to the hospital immediately. So it is important to be looking at those recognition features that will alert you in your next course of action. So at this point, I'll allow Mr. Lawi to release themselves. Okay, so after 2 minutes, I realized that the convulsions or the fitting, the jacking has ended. So it is important for me to come and place Mr. Lawi in a recovery position very fast, which will enable Mr. Lawi to have airway opened.
So after the seizures have stopped?
Yes.
Okay.
Yes. Check if he's breathing. Okay. Make sure that they are indeed comfortable position because at this point we want to ensure that they have what we call full recovery. So let's also consider their full recovery, but let us also consider that it may reoccur.
Right.
Check if they are breathing. One of the dangers of seizure is when they are fitting, jacking, they are not breathing. So you can imagine someone who is not breathing, then they'll be confused.
Yeah.
Okay? Let us also take great care of their dignity. Sometimes they can urinate on their clothes or even defecate on their clothes. It's unnatural because they are not in control of their muscle. So if that happens, they usually feel embarrassed. Please cover them. It is our responsibility. Yes.
I was having a conversation some weeks ago with someone who, seizures and well used to as a whole condition, matters epilepsy.
Yes.
And they'd say the body sends some signal to them.
Yes.
And just alerting them,
Yes.
that the seizures are coming.
Good.
For example, they'd probably have let's say like two seizures
Yes.
in a day quite oftenly. How does that happen?
Okay.
Tell us, also for someone who also lives with, let's say, someone who is epileptic.
Yes.
Should even for the environment around them.
Yes.
How should it be designed?
Okay. It is also important to note if someone is a non-epileptic, for example, before it occurs, there are other factors that can lead to seizure. Yeah. For example, extreme exposure maybe to light or noise, or maybe the food that they eat or not eating at all. So before it actually occurs, there'll be the initial signs that a patient will have. For example, they will feel like an aura. Okay? You will see them having blank stare, and then there'll be what we call small muscle twitching. So when you see, maybe you are having a conversation with them, and they suddenly stop, and then they suddenly start staring in one area, and then the next thing, small muscle twitching before they fully go into full muscle jerking and twitching. So it is important that we're also able to know what triggers their epilepsy.
So that you can also pre-plan kind of...
Precisely.
Okay.
And again, where they are, make sure that that area is completely safe. I'll give an example. Maybe it's a mother who is cooking and they get this attack while cooking.
Yeah.
So you can imagine it is the fire around that area. So it is important that you be careful in terms of where they are going to fall. So guide them. But if you are not there and they fall, the first thing you want to do is check on their safety. There are some people who can they could be swimming, for example, and they get attacked inside water. Okay? So again, at that point, it is important also, that's why lifeguard should always be alert on everyone who is swimming. Because when you get an attack, the next thing is you'll just be jerking inside water and then fall down. Or driving. And I've seen this. Driving, you have epilepsy, and then you are driving. It happened some years back in Galleria, at the entrance where you find that driver came, they were stopping to get in, and then all of a sudden the person got an attack, stepped on the accelerator, hit all the cars in front, everyone scampered for safety. So it is important to also know that you are an epileptic person, and sometimes it is also important for you to always alert people around you, or just inform people around you, just in case it occurs, they are there to help you.
Right.
Yes.
Does Red Cross train young children? Because this often happens in schools, and you'd find even in boarding schools that someone has quite often seizures, and they probably nani anakuga na seizures, tukicheza naye ball, anafanyanga hivi, but then they don't really know what to do.
Yes.
They do ile kienyeji.
Yes.
Does Red Cross also train some of these young children?
Sure. Red Cross trains the entire public.
As Lawi akisimama
akiamka, Mr. Lawi,
hapo kidogo unaweza pata usingizi hapo vizuri.
Yes. So it is true, Red Cross trains the entire public. So here we are also looking at companies, corporates, organizations. We're also looking at training institutional, for example, universities, secondary and primary. In fact, we have a whole program for the young ones, and how I can say this is we can meet in September. We usually have first aid competitions for all categories.
Fantastic.
And in this, you find that if everyone has been trained, we just want to test their efficiency in terms of application of these services. So for us, we train everyone. And we usually customize our trainings to suit the current need.
Right.
Yes.
Wherever you're watching us from, so far we've tackled heart attacks as well as seizures, just taking a look at different age groups as well as gender. And so far, unafeel kama you haven't really gotten some, you still have more questions than answers. You can call us live, 0795 045 864 is the number to call us live. Sami will be answering your questions on the same. So any additional on the seizures before we cross over to nose bleeding? Okay,
yeah, it is again important to note for people who are non-epileptic, for example, they also have their own medications. So as I said earlier on, a first aider, as you assist a casualty, also find out if they have had their own medications. It is very important. But of importance to note is you must refer a casualty to the hospital all through. Every emergencies that we manage, including fitting, jacking, take this casualty to the hospital and assist them throughout the process. Yes.
So wait, as much as let's say it just happened and it probably went on for a minute and a half, and this person regained consciousness and they're still okay. Do they still have to go to the hospital, or we atakuwa tu sawa?
At this point, there are things that you need also to assess. First, again, check on their airway, check on how they are breathing, okay? And then check whether they are oriented. Actually, if you want to know that someone needs to go to the hospital if they are disoriented, anything that affects the mind, then it means the problem could be bigger. But if they are alert, disoriented, and it's something that has been recurring, then you will continue to monitor them. But if it is the first time they're having this condition, they must go to the hospital.
Okay, right. So now to should I call it a condition, or one thing that really happens to the better part of us, I included.
Yes.
I'd probably be somewhere after very hot sun,
yes,
for quite the day, and then start having some nosebleeds.
Yes.
You're asking yourself, imetoka wapi sasa? And it will probably continue. And I think one of the biggest things that I do is probably pinch my nose, nieke something cold on my forehead,
yes, and
then tilt the head.
Yeah.
Many people have their own variations.
Yes.
But first off, let's start with why do we even have nosebleeds?
So nose bleeding is blood coming from the nostril.
Yeah.
There are various factors that can lead to nose bleeding. One of them is a certain medical conditions that you may have. For example, hypertension. And as I said, hypertension is something that must always be taken care of. That is one. Two, there are other environmental factors such as changes in temperature. For example, extreme temperature, which is very hot or very cold, are most often very hot. So you find that when it is too hot, then the nose can nosebleed. Of course, we also have other factors such as injuries especially to the facial region and then the nostril. Yes, yes. That one can also lead to nose bleeding. So there must be a cause that can lead to nose bleeding. So that means if you look at the structure of the nose has its own blood supply, and that is where blood is coming from. Now, of importance to note is if the blood is coming from the nose and the ears and any other, for example, mouth, then that is a serious condition. We are talking about the head injury. But if it is the nose alone, then we could be looking at those factors that I've mentioned earlier.
Right.
So when it happens, most often what happens, blood will come out. It's very annoying, and I know someone will become anxious in terms of what's really happening.
Yeah.
So the most important thing to note is in any bleeding control is application of direct pressure.
There's also, I believe, something that you should also add, and many people, are fond of doing this, picking their noses.
Yes.
And so someone might, be amezoea kufanya hivyo, and then they realize that nose bleeding.
Yes.
Tell us how that happens. Someone probably just picking their nose, and they probably poked a part of their nose, and they start bleeding.
Yeah. And it's very common in children. Rarely will you see it in adults unless this is an adult who is very stressful.
Yeah.
Of course, yes, poking the nostril can affect, because as I said earlier on, there are many branches of blood network that is supplying the entire region with oxygenated blood. So if they are punctured, this network of blood vessel, if they are punctured, it will lead to nose bleeding. So again, for children, it's common occurrence because they like playing a lot. So you can find that when they're poking their nose, it can lead to nose bleeding. Sometimes someone could even be sleeping, okay? And yes, just at night or when they wake up in the morning, they find themselves nose bleeding. So again, we're also looking at what could be the underlying medical conditions behind it. If it is too cold, again, it can also lead to nose bleeding. Yes.
Right. So all those factors are constant.
Yes.
What is the first thing that you do when you realize the first two drops? And also now for different factors, are there that, because kama let's say you're jua, so at the end of walking somewhere that has some hot temperatures, it would probably be coming out drop by drop. But then the others that it will be flowing. Yes.
Yes.
Tell us about that.
Yes. What normally happens, it may not necessarily come out as a drop, because once the blood vessel is ruptured, it is ruptured. So blood will continuously flow. So even if it will start with a drop, eventually it will be flowing. So in whichever factor that has caused the nose bleeding, the first thing that you must do is remove the casualty from the factors that led to nose bleeding. So for example, put them in a cooler area so that you can start taking care of them. But of importance is do not allow more blood to come out, because that blood is needed in your body. So in whichever cause of nose bleeding, you must ensure that you conserve as much blood as possible. And that is the main focus in first aid. So Mr. Lawi, so please, Mr. Lawi has nose bleeding. So the first thing that I need to do is allow Mr. Lawi to sit down.
Okay.
So please sit down. Okay, so because they are conscious alert, I talk to them. Mr. Lai, my name is Sammy, and I'm here to help you. I can see that you are not bleeding, okay? Yeah. So what I want you to do, I want you to lean forward, okay? And then pinch the soft part of the nose. So when I say the soft part of the nose, pinch, and then open your mouth, breathe through your mouth. Breathe through your mouth. Now, if there's any blood that is inside your mouth, I would like you to spit it out. So you spit it out.
Oh, okay.
So you pinch the soft part of the nose for at least 10 minutes.
So even as you continue, I'm being told that we have a caller who's trying to reach us, Brian from Thika. I don't know kama tuko naye Brian. Brian, habari asubuhi?
Nzuri sana.
Yes, asante sana for calling us hii asubuhi. Uko na swali au maoni?
Niko na swali.
Yes, uliza.
Nilikuwa nauliza what if mtu alikuwa ana nosebleed?
Sorry, akwenda?
Someone was nosebleeding. And then in the process akafaint.
Akafaint haba unasema?
Yeah, akafaint.
Okay,
And then after fainting, the nose bleeding still continues.
Okay.
Is that, what am I supposed to do?
Sawa.
Okay.
Asante sana Brian Kimani kutoka Thika. You can always call us live 0795 045 864. Sammy will be answering all your questions that you have.
Okay. Thank you for that question. So, as we were saying earlier on, you pinch the nose for at least 10 minutes. This basically, it enables the pressure to be minimized, so there'll be no more blood flow. So when I say 10 minutes, essentially we're also encouraging blood clotting. Okay. So at this point, after 10 minutes, you may tell the casualty to let go. Mr. Lawi, please let go, and let's see if bleeding has stopped. Now, at this point, we expect bleeding to have stopped. But if it hasn't stopped, Mr. Lawi will continue to pinch the nose for at least another 10 minutes.
Okay.
Now, we are saying here is we are accelerating clotting. So we expect within the 20 minutes, bleeding should have stopped.
Right.
So at this point, we expect bleeding has stopped. Right. Now, please, Lawi, let go. And we realize bleeding is continuing, then there's a much bigger problem.
Okay.
Yes. So someone who is continuously bleeding for 30 minutes, it's much bigger than nosebleed.
So, and so to, okay. Tuchukue ya Karo. Kutoka Kakamega, habari asubuhi?
Nzuri.
Asante sana kwa kutupigia. Kuna swali au maoni?
Niko na swali.
Yes, uliza.
Mimi nimekuwa na history ya nosebleed. Tangu niwe mdogo. Sasa wakati nilikuwa nosebleed, nikiinama ndio ilikuwa inatoka mingi tu sana. Sasa
for how long labda?
Ilikuwa inatoka hata karibu an hour. Alafu sasa hii kitu imeshika mtoto wangu sasa kijana. Sasa kijana kidogo tu nosebleed, akiinama inakuwa mingi. Sasa inabidi mpaka aoshe kichwa na maji baridi na atulie ndio itulie. Alafu mimi hii yangu nayo imenisababisha sasa niko mtu mzima, lakini nikiwa na homa hapa kwa throat na kuanga na problem sana, inafunganga, lakini sasa hii nosebleed.
Sawa, asante sana Karo kutoka Kakamega.
Sana naomba usaidizi.
Yes, sawa, asante sana. Yes, back at home, wherever you're watching us from, 0795 045 864 is the number to call in live. We're discussing right now matters nosebleeding. Earlier on, tulikuwa tunaongelea heart attacks as well as seizures. In case uko na swali regarding those three, tupigie simu, Sami will be answering them for you. So far tumepata 2 callers.
Yes.
And hii topic ya nosebleeding is one that is really common to people.
Yes.
So first off, tuanze na Kimani kutoka Thika.
Yes.
Kimani anasema hypothetical, let's say Alawi hapa.
Okay.
Alikuwa na nosebleed,
okay,
alafu akafaint.
Okay.
Lakini hata after kufaint, yes, bado nosebleeding ikaendelea.
Okay.
Yes.
Okay. So as we said earlier on, it is important to control the bleeding, but then hypothetically akifaint tena, then it means they are not able, so they have a temporary loss of oxygenated blood in the brain. So that means they are not able to support themselves. So that means that they will need to lie down. So what we need to do is look at how do we prioritize the management, because the reason why we are allowing Mr. Lawi to lean forward is so that the blood does not go back.
What's the possibility of okay?
Yes.
Is it Naipei? Naibei kutoka wapi? Emmanuel Naibei kutoka Makadara, asante sana kwa kutupigia. Emmanuel, habari ya asubuhi?
Salama sana.
Yes, ni swali au maoni uko nayo?
Okay, niko na maoni kidogo na swali.
Yes, uliza na utuambie.
Nimefurahia sana kipindi kwa sababu kuna first aid, kuna vitu vinafanyika kwa nyumba zetu. And we don't know exactly what to do. For example, mimi nimewaipata ajali kidogo ya stima. And I know nilifaint, but there was my brother mwenye alikuwa ameenda NYS. Aliniokoa kabisa through first aid.
Okay.
So napongeza kipindi. But swali langu ni kwamba nataka kuuliza Samia hapo. Kwa hii mambo ya nose bleeding, what if tuseme patient ni ako hemophilia?
Okay.
Yes, what will happen?
A good angle to that. Asante sana Naibei kwa hiyo swali na for your for the compliment.
Asante.
Sawa, salimia watu wa Makadara. So I've even
I'm on track.
Good.
I'm on track. So so nose bleeding, fainting. So prioritize care. So hapa.
Oh, I remembered. So what I wanted to now bring into this new bit before we also answer Karo kutoka Kabega. For this one, how possible is it if you're nose bleeding for quite a while? Karo natuambia that hers can go for even an hour. Aki bend. How possible is it for this person to faint? The fact that they don't really have enough oxygen in the head.
For example, your issue ya Karo, bleeding continuously is, again, as I said earlier on, is not good. Because you are depleting yourself essential product that's supposed to circulate oxygen and nutrients to the body cells. So at this point, and I usually tell people, hata ukibend, now you do not put pressure, but damu bado itaendelea kutoka. So of importance, it is to pinch the nostril completely so that you constrict the blood vessel, isitoe damu. So niko sure kama alikuwa angekuwa na pinch the nostril, hiyo damu ingekosa kutoka. Because uwezi kuja mbele peke yake alafu uiache damu itaendelea kutoka. Na ikiendelea kutoka hakuna kitu itaizuia. And that is why you can continuously bleed without stopping. And that is why tuna insist the bridge of the nose hapo katikati must be pinched.
Hapo katikati.
Hapo katikati.
To the
bridge of the nose hapa. Si yote hivi. Hapa katikati hii. Hapa ndo kuna major blood vessels.
Okay.
Hapa tumeona.
Because I feel like when you say the bridge, and even for me, my own understanding previously was this the carbon hapa katikati, you press it and not the soft part.
It is actually the soft part because we have the nasal bone hapa inaishia mahali hapa. This is the fleshy part, and that is the fleshy part is the one that has many blood vessels.
You're supposed to.
So it is the fleshy part that you must pinch like that. So unaona nimeacha hata kuna space hewa inaweza pita. Hapo ndio unafaa kupinch. So I was nimesahau jina yake kutoka Kakamega. It is always important to pinch. Karo.
Yes.
So anafaa kuwa ana make sure ana pinch hapo.
But is it okay?
Yeah. So as I can say anasema imeenda paka kwa mtoto wake. So again swali ni umeenda hospitali ukakaguliwa. Because remember first aid is not treatment. First aid is managing the condition at that point. Lakini anahitaji daktari akague zaidi aone hiyo chanzo ya nose bleeding ni nini hasa ndio aweze kupata matibabu zaidi. Now in case now someone faints, hata kama atafaint, priority ni airway. So akifaint utamweka on one side kama recovery position. So it is always important kuangalia, yes alikuwa na nosebleed na akafaint, mweke recovery position so that whatever ilikuwa inatoka iendelee kutoka. Now, danger ya kurudisha mgonjwa nyuma, okay, vile tulikuwa tunafanya kitambo, damu inaweza rudi mbali, inaweza rudi nyuma, anaweza kuwa na sensation ya kutapika ama kuhisi kutapika. Na unajua matapishi ikikuja juu inaweza cause what we call aspiration, kumaanisha hiyo matapishi inaweza ingia kwa ile pipe ya hewa. Very dangerous.
So it's because a number of people do this. They'd hold the bridge, as you tell us,
and then no, that is wrong intervention. So you're supposed to have a free flow in case the damu bado ilikuwa inatoka.
And just
isirudi nyuma, cause choking ama vomiting sensation.
What's the science behind having a cold cloth on the forehead?
Precisely. So a cold cloth or what we call a cold pack.
Before we also get to Naibe's question here, hemophilia.
Yes. Yeah. So a cold pack is something cold. This is a cold pack. Essentially, if you have pinched the nose and bleeding was massive, you can actually take a cold pack or a wet cloth and then place it slightly between the forehead and where the bridge is. Hapo. So the science behind it, it may not really control bleeding, but it can actually constrict the blood vessels, which will have low blood coming out as opposed to larger blood vessels, more blood coming out. So eventually, when the blood vessels constrict, so there'll be less blood, which now will accelerate clotting.
But Sami, Karoki pale Kakamega angetaka kujua, hana hii.
Yes.
But ni nini ngine anaweza tumia kama hii?
Chukua kitambaa, Karo. Chukua kitambaa na any kitambaa or tuseme dressing. Place it in ice.
Ama ile maji baridi kabisa.
Weka ice. Ukikosa ice hata maji. Maji tu ya kawaida. Sometimes unaweza kosa hata hiyo maji baridi. Just the normal water. Iekele tu hapo. Hivyo tu. But remember,
hapo katikati ya
hapa katikati. Yes. Si hapa, ekelea hapa katikati namna hiyo. But remember, ukumbuke first line management is pinching the nose. Yes. Hii inaweza fanyika mara pili.
So many people do this, the whole forehead thing.
Yeah, they do it, but remember where are the blood vessels? See, blood vessels zimekuja ziko pande hapa.
So ziko hapa kwa.
So you target where the blood vessels are. Namna hiyo.
Naibe asked a very important question because last week was World Hemophilia Day.
Yes.
And we were having this conversation last Monday. And I mean, quite a huge, or rather a small percentage of people do have, hemophilia. And this really now affects men.
Yes.
And anauliza, so what if niko hapo hivi na Lewi na akona hemophilia.
Okay.
And yes, ni wale akikatwa kidogo damu inaendelea non-stop.
Actually. Thank you for that question. Let me say this. It is good that you know you have a medical condition. Hiyo ni very important. First is recognition. Because we know hemophilic patients will not have spontaneous clotting, it is important to minimize any form of injury. Now, akiwa na nose bleeding na he's hemophilic, then chances are the person will continue to bleed further. So again, it's very unfortunate that they may have an injury. At this point, the most appropriate thing to do is direct pressure. Hata akiwa na cut ama injury ya aina yoyote, hapo lazima afunge hiyo mahali ambapo imekuwa the wound with a lot of pressure as this person goes to the hospital. Same case applies to nose bleeding. Akiwa na nose bleeding and is hemophilic, chances are unaweza pinch na ikose na bado iendelee. Remember nilisema unaweza pinch up to 30 minutes na bado damu inaendelea. There could be another underlying medical condition.
So this might actually be now the hemophilia.
Exactly.
Okay.
So please just take the casualty to the hospital. At first aid level, ours is to support. We do what we call supportive care to the casualty until they reach to the hospital. We want to prevent further injury. We want to prevent them from going into shock because remember, if someone continuously bleeds, they can actually go into shock, which is something not good to any casualty. And because shock, if again is not controlled, it can actually lead to death. And it is at this point tunataka kuconserve hiyo damu as much as possible.
Sawa.
Yes.
Yes. Asante sana Lawiko kuwa mgonjwa wa heart attack, seizure na nosebleed.
Yes.
For today we have about 4 minutes to wrap it up, discussing all these three that are very common in very many households out here.
Yes.
Just a summary of what maybe someone is just tuning in right now.
Yes.
And they're wondering, I should have joined it.
Okay.
A summary advice to all this, the three of them wrapped up together.
Okay. First we started by discussing heart attack, and we have said heart attack is a medical condition that affects the heart. Part of the heart muscle dies because it did not receive oxygenated blood. It is dangerous, and it is at this point that we need to call appropriate medical facility. Lazima tukuwe na namba ambulance ya kupiga. Mimi sijui kama Stanley unajua namba yoyote ya ambulance yenye unaweza piga.
No, that's the thing about numbers ambulance.
Yes.
In my view,
yes,
they're too long
yes,
to even remember them.
Yes.
Yeah.
Yes.
Shushu wangu pale Nyakimincha huko hata kumbuka namba yote refu. Why is it that they're not probably just 3 code numbers?
Yeah, and I think as we are moving to make Kenya a better place, one of the reforms that we are doing as a country is also to streamline the EMS industry.
Oh, yes, yeah.
And EMS industry essentially comprises of the ambulance services, where we are going to have a coordinated ambulance services across the country.
Right.
But Kenya Red Cross has an ambulance. Short code is 1514.
1514.
1514, countrywide. So shosho yako akiwa na shida yote 1514 aseme anataka ambulance, atasaidika.
Sawa.
Yes. So heart attack, you need to call an ambulance immediately, na mgonjwa anafaa kwenda kwa facility ambayo itamsaidia kukana na.
Is ambulance free? And because of time again, you can now wrap it up and give us your final thoughts. Is ambulance free?
It depends. We have the free service, but again, we also have services that are for all the consumers.
Okay,
yes.
Right.
Yes.
Your final, in a sentence.
In a sentence.
Your final thoughts.
Okay. Let's take care of ourselves as trained first aiders, or someone who wants to help someone who is in heart attack or seizure or even nose bleeding. Our priority is to save that life and to ensure that they are taken care of throughout the process before they go to the hospital.
Thank you very much.
Thank you.
That's why we put that full stop. A very long sentence as it is. Asante sana Lewi, asante sana Sami from the Kenya Red Cross Institute. And for you back at home, for all those who call, for all those who send SMSs and messages, pale Facebook TV47 KE. I'm yours truly, Stanley Jaringita. We do this every single Monday, telling you what you need to know about your health as well as matters first aid. On behalf of Indiboli, goodbye, tuonane kesho. On behalf of the whole team hapa hivi, kwaheri.